right now. As an additional just overview of who I am, yes, I am a, this is weird, I have to open this. I am a third-year resident at GW in internal medicine, pursuing a career in cardiology, starting fellowship this summer. And my career goals are in integrative and preventative cardiology, which is why I'm joining you guys today. And let me see if I can go ahead and share my screen. Let's see, it's not allowing me to do that right now, sorry. Let's see, having a little bit of a share screen issue. Is it possible, Janet, for me to send you my presentation?
Do you want to just, you mean just want to email it and then
yeah, absolutely.
I can, here, let me just email it to me.
Okay, perfect. I'm sorry about that.
That's okay. You want to use, I just sent you email, personal email. I think Gmail will go faster if you send it that way.
Okay.
Okay, I think while we're waiting, as more people arrived, those of you in Maryland, I'm not sure about DC and Virginia, but Maryland just announced today that all the adults over 16 can go get vaccinated. And I think it's the same registration site, the Maryland Department of Health specifically established page. So Nedda, I don't see the email yet.
I just, okay, so you should have gotten it right now. Did you get it?
There we go. Yeah, I got it.
Dr. Kogan, for Virginia, it's going to be general public begins April 18th.
Good. Nedda, it's asking me for, it's requesting access. I'm not sure. I just sent it to you. I guess because it's a new account for the Google Drive. Seems like I had technical difficulties on my podcast. I started the PowerPoint and my computer died. I hate when that happens. So it just had to restart the computer. It just froze completely, like nothing was happening. It just went black and that's it. And I was like, all right, let's see. There we go. Okay, so I'm gonna, I guess let's do this. View. Full screen. All right. Okay, so I guess I'll just, Ned, just tell me when there's the next slide. So I guess we'll do that.
Perfect. Thank you so much, and sorry about the technical difficulties. I'll never get used to the system, I feel like.
And I don't know how to make this full screen, so I guess let's just do it like that. That's fine.
Looks perfect. I love it. So my discussion today is going to be based predominantly on the relationship between our mental health and how it affects our heart health, so cardiovascular disease. Most recently, in the end of January, the American Heart Association released a scientific statement highlighting the importance and the relationship of our mental health and heart health for fellow cardiologists and physicians. So that's really going to be my discussion today, just kind of breaking through that. Next slide, please. So most recently, the CDC released the provisional 2020 cause of deaths. So it is subject to change, But we see right now that COVID is now number 3. But however, heart disease is still reigning as number 1. So it's something that we still need to focus on is on prevention, that something is preventable with lifestyle and of course, mindfulness. So we all need to be aware of that. And of course, COVID unfortunately is now number 3, which hopefully we all get vaccinated sooner than later and we can put this pandemic behind us. Next slide, please. Perfect. So goals of the discussion, again, just highlighting what the scientific statement is and released by the American Heart Association, which is one of the leaders in cardiology. They release guidelines with association with the American College of Cardiology. So it's what cardiologists usually focus on. In addition, the fact that they highlighted the importance of mental health is really remarkable, just kind of bringing to light the importance of a holistic, more integrated system in cardiovascular disease. In addition, I'm going to be defining mental health, the negative psychological health and its impact on your heart health, positive psychological health and its impact, at-risk populations, and approaches to treatment, which of course is always not a one-size-fits-all type of situation. So next slide, please. So as stated previously, in January 25th, 2021, the American Heart Association acknowledged the impact of our mental health on developing cardiovascular disease. So the association's goal by releasing this statement is to educate healthcare community on the impact of mental health and cardiovascular disease, decrease the emphasis on just the one physical condition of the heart, and really understand as treating the patient as a whole and appreciating that your mental health could affect your heart health, highlight at-risk populations, and it also gave information for cardiologists on how to screen patients with cardiovascular disease, screening them with for mental health, and so we could address treatment for that as well. I actually did end up writing an article highlighting this topic for ABC News, and one of the authors of the scientific statement was Dr. Michos. She said this very eloquently, so I really love this quote. No cardiovascular disease should be addressed as an isolated entity, but really it's part of an integrative system where the mind, the heart, and the body are all interconnected, and I could not agree with that more. So what really is mental health? So the WHO defines mental health as a state of well-being in which an individual realizes his or her potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. The American Psychological Association defines it as a state of mind characterized by emotional well-being, good behavioral adjustment, relative freedom from anxiety and disabling symptoms, and capacity to establish constructive relationships cope with the ordinary demands and stresses of life, which, as much as these terms of definitions of mental health really try to cover, or more of an umbrella term to cover all things that can cause poor mental health or related to poor mental health, really it's hard to define as we are coming to light to understand the different things that can affect our mental health. But these two organizations really do their best to make it more of a broad term. So the organization, next slide, please. So the AHA scientific statement broke down the paper as highlighting negative mental health and how it affects cardiovascular disease, positive mental health and how it affects cardiovascular disease, screening, and different ways that we can kind of approach this topic. So for negative mental health, they focused on depression, which is very common among cardiovascular disease, patients with cardiovascular disease, anxiety, pessimism, hopelessness, anger, and hostility. Next slide, please. So negative mental health. So overall, all of those things that are considered negative mental health or having this kind of mindset, unfortunately, activates a sympathetic response in our body, which is our fight or flight response. So our fight or flight really, in the end of the day, elevates our cortisol levels. So by increasing our cortisol levels, you end up having increased inflammation, depressed immune function, insulin resistance, which is related to diabetes, and elevated blood pressure, which we also know as hypertension. In addition, negative mental health can also cause increased oxidative stress, which is linked to aging. And then the previous slide, please, there was one more note. And of course, depressed vagal tone, which the vagus nerve is related to our parasympathetic one, parasympathetic nervous system, which is related to rest and digest. Next slide, please. Thank you. So looking at the research, studies have shown that anxiety increases the risk of hypertension, cardiac death, heart failure, and coronary spasm, which coronary spasm is really a fancy way of saying that your coronary artery just compresses really tightly, causes poor oxygen flow to your heart muscle, and that as a result can give you symptoms of a heart attack and can even cause lab values that would make you think you have a heart attack. But when you're sent to the angiography where they check to see if your coronary arteries have any blockages, your coronary arteries are clear. And that's usually considered a coronary spasm. And there are many things that can cause that, but anxiety is one of them. Depression increases the risk of the first heart attack, especially patients who've had one heart attack and they are at very high risk for depression. And that can even increase their risk of having a second heart attack. There's a relationship with increased risk of stroke and increased risk of mortality from cardiovascular disease. Anger was broken down into two topics. So it's very interesting to see anger. They looked at the short-term anger. So about 2 hours after expressing a large amount of anger, they saw increased blood pressure, increased clotting, increased heart rate, of course. And then long-term anger was linked to higher rate of death and early onset cardiovascular disease. In addition, short-term anger is also shown to have a higher rate of irregular arrhythmias, which we call ventricular fibrillation. And that was after 2 hours after an outburst of anger, and that can lead to death. PTSD is also associated with 61% increase in heart disease. So again, prior trauma, PTSD, those were all related to increased risk of coronary disease as well. For those of us who like to look at the biostats, I put this chart in from the American Heart Association. So this one kind of breaks down each type of negative psychological factors and looked at the relative risk of developing either heart failure, stroke, mortality, or cardiovascular disease as well. So I can, if it's okay, I can address questions now, or would you rather have me address questions at the end of the discussion or end of the presentation?
How much more time you have, do you think? A couple more slides. Why don't you finish this and then we'll take questions.
Okay, great. So the next topic is positive mental health, which was very hard to study, just given that there aren't as many ways. Again, these topics are very difficult to study in science just because it's very subjective. It's very hard to measure, but they looked at the best research that they could find, largest cohorts. Some of them are randomized control, but majority of them were observational or prospective cohort studies. So positive mental health, they looked at mindfulness, optimism, meditation, having a sense of purpose, resilience, and gratitude. Next slide, please. So overall, with positive mental health, there is overall improved health behaviors. So patients typically had healthier diets, improved sleep, daily exercise. They're less likely to smoke. There was lower evidence of inflammation with looking at inflammatory biomarkers and normal cortisol levels, which are measured in the morning and in the evening. And these are all associated with having a lower risk of cardiovascular disease. So breaking it down by each type of positive mental health, I looked at the most pertinent ones and most researched. So optimism was associated with a lower incidence of stroke, heart disease, and death, with a 35% decrease in risk of cardiovascular disease. And optimism was, that one was defined as having just positive outlook in everyday life, regardless of, how do I explain it? Yeah, so just positive outlook of everyday life. They, even with a problem, they always thought about the positive outcome that could happen rather than being more pessimistic, which they looked at with negative health behaviors. Mindfulness was associated with a lower rate of smoking, higher rate of exercise, restrained eating, lower body mass index, and fasting glucose of less than 100 milligrams per deciliter. And then happiness, patients with diabetes with higher positive affect actually had a lower rate of death 10 years after follow-up. So they had diabetes during the 10 years, but had a lower rate of death. And diabetes, the largest cause of death in a diabetic is cardiovascular disease because it causes microcalcifications. And then 22% decreased risk of heart disease overall for among patients who are happy. So again, I just gave a breakdown looking at the statistics of the relative risk and harms ratio of all these positive psychological factors for anyone who was interested in looking. But next slide I wanted to look at is talking about those who are at risk, and the scientific statement highlighted that women are more at risk for mental health affecting their cardiovascular health. One of the big things that we learn about in medical school and we've seen in residency is called Takotsubo's cardiomyopathy, which is also known as broken heart syndrome. It's because of emotional distress causes a high surge in the sympathetic response. It ends up predominantly affecting beta receptors, which are in the lower region of the heart. I don't want to get too medical here, but it ends up causing this balloon-like picture in the lower region of the heart, which actually can cause signs and symptoms of a heart attack and does resolve momentarily later, but some people do have effects that are lifelong. So just kind of breaking down the slide further, as I said, women are more at risk. They are found to report mental health concerns, predominantly anxiety or depression, more so than men. So that's probably a reason why we see it more among women. Women are generally more at risk for depression. They also have this caregiver role, so where their self-care is not prioritized. So maybe they won't go to physical exams, they won't focus on their nutritional intake, exercise, because they're so preoccupied with caring for their children or the general household. Women were found to be more optimistic. Women who were more optimistic were found to have a slower development of plaque in major vessels that feed the brain, which is the carotid arteries. Women with PTSD or a history of trauma also had larger levels of vascular adhesion molecules, which really just means they had higher levels of these molecules that accelerate a plaque process. And again, Takotsubo's, which I discussed earlier. Next slide, please. So the approach in improving mental health is really not a one-size-fits-all model. The scientific statement looked at different ways that they can approach this topic. So of course, antidepressants were kind of the first things they pulled at. One study that they found showed that there was a reduction in second cardiac event among people who had someone who had one heart attack was found to be depressed, started an antidepressant, and then their risk of developing a second one was reduced. However, it was just one study and it was a very small study. So we can't really say that antidepressants decrease the risk of a second heart attack among patients who are depressed after a first one. It really is, again, not one size fits all. Behavioral group therapy was found to have a 41% reduction in heart attacks. Psychotherapy was found to be beneficial in reducing depression, but not cardiovascular events. However, if you if you reduce depression or decrease the risk of depression among people who have one heart attack, then maybe they're more inclined to have more positive lifestyle, like eating better, taking their medications, exercising. So it's really hard to kind of measure which model is the best. And of course, meditation is one that they evaluated, but again, very hard to study and show that it has a strong impact. But again, when you are approached with a patient who is at risk for cardiovascular disease or has mental health concerns, then you can always give them multiple different types of ways to kind of approach and heal their mental health issues at this time. Next slide. So this slide pretty much just highlights that's really just not a one and done type of process. You have to look at everything. So people who have negative psychological health, yes, we can say that they have higher rates of chronic inflammation, which causes immune suppression and higher cortisol levels, insulin resistance. But at the same time, people who have negative psychological health are also more likely to smoke, more likely to eat poorly, more likely to not exercise, have poor sleep patterns, which can also increase your blood pressure. And then in respect to that positive psychological health, as I mentioned earlier, people are more likely to take their medications, be more optimistic, which can lower cortisol levels, as we've seen. They are willing to exercise, eat better, go to their appointments. So we can't just say, yes, mental health directly affects cardiovascular health, but again, it's treating the whole system and the whole person and kind of taking into account that these things are all interrelated. And thank you so much. These are my references, and I'm happy to take any questions.
All right. Thank you so much.
Of course.
Let's, yeah, so we have about 5 minutes. So anybody, please direct your questions in the chat.
There are already some questions in the chat, Misha. If you could scroll back through it.
I'm trying.
Okay, so I wonder how they define anger. Okay, so that's a great question. So anger, they looked at the physiological response of how they had elevated blood pressure, elevated heart rate. And again, anger is very much hard to define. They kind of looked at someone's outlook on life and whether they were hostile. So they kind of grouped anger and hostility together for a better measurement. However, again, like I agree with you, it's very hard to kind of just say, oh, that person's angry when maybe they could be judgmental. But again, that's more of like a hostile type of feeling. So again, that's kind of how they kind of group those things together.
There's a question from Irene, who always asks tough, good questions. So can you define the perspectful? I think it means perspectful or retrospect? Perspectful observation.
Okay. A prospective?
Perspective.
Prospective cohort. Yeah. Okay, so prospective cohort is essentially looking at a group of people who have, and Dr. Frame, definitely correct me if I'm wrong. So it's a group of people who are generally hopefully similar at baseline, and they are exposed to whatever they are studying. So they have a known exposure, and then you monitor them for years to see what their outcomes are.
That was very, very, very good. Just the only thing I would add is the opposite of prospective would be retrospective. And that means we're going back and looking, and you could see where following them in real time could be a stronger study design. We might get more information. Whereas if we're looking back at charts, we don't know a lot about the people and we don't have as good information. So I think it's a sign of strength of that research.
Yeah, I think it's a one step down from from some form of controlled trial.
Yeah, absolutely.
Right. Did I miss anything? I don't see anything else, actually.
There is a question about if there's research on lesser developed societies or war-torn areas. War-torn areas.
Yeah, that's a great question. So from what I understand, definitely areas that you have a concentration of like refugees, for example, if you think about people who are displaced from Syria, those populations definitely have a higher risk of cardiovascular disease, just given the trauma from what we see from prior slides. Again, we can't say one study is an example of what's going on with all people, but it is definitely something that we have to take into account. I personally do not know exactly of looking at war-torn areas and the development of cardiovascular disease myself, but I'm happy to look into that, given that's a really great question. But I would assume that they would have a higher risk of cardiovascular disease.
The only other question I see is, was there a study done on genetic or inherited or previous generational traits? Oh, that's a great question.
Yeah, that's a really great question. So with this scientific statement, I did not see anything highlighted regarding genetic or inherited traits. But again, that is really interesting if you look at family history of known mental health conditions such as depression, especially, or anger, or being raised in a certain area or family upbringing, whether that would have an effect. There was an aspect of this scientific statement that did show that children who were succumbed to trauma did have higher rates of cardiovascular disease early on than expected, and without any family history. So that was something to highlight, but they did not highlight anything about genes, which I would be interested in looking in as well.
That's great. Well, I think we're right on time. So if anybody else have more questions, looks like you really captured the audience today because there's no COVID questions. I'm enjoying myself. I don't have to answer anything. Anyway, so let's move on to Pilar. And if anybody have questions in the last 5 minutes, maybe we'll end a couple of minutes before. And if anything left, we'll finish up with that. Thank you, Nedda. It's always awesome to have you here. I hope
Yeah, thank you so much. I'm always happy to be here.
Not the last time, I'm sure. All right. Okay, so Pilar, the floor is all yours.
Hello?
Pilar?
Can you hear me?
Yeah.
So I lost the video for some reason. I don't know why.
There you are. We can see you now.
I know you can see me. I cannot see anyone. Sorry.
Maybe that's a blessing.
Okay. So because I cannot find the screen, at some point, probably someone needs to read me the questions, if there are any. This is going to be interesting. My name is Pilar. Thank you so much for having me here today. Thank you for making me part of this community. I have been enjoying the videos and the sessions. Today, in thinking what I wanted to bring to you today, and because I'm going to be here with you for a couple more times, I thought of this as more of a series called Inner Space Series. A little bit about myself. I am a lawyer by training. I have an MBA from the George Washington University. I am an alum. And I also work for GW for the Career Center at the Business School. And my practice, my inner space practice and well-being practice is probably 20 years old or a little more. And what informed me in investigating and researching even more, my mother got pancreatic cancer in 2004, and that was a journey into nutrition and the body and the mind and the stress and the illness. And my father later on got Parkinson's disease, and he passed away in December. And these journeys with my family made me a researcher and also a deeper practitioner. And later on, I became a yoga instructor, and I also formed a company called Simple, which is about the whole human being, performance and life balance, and for organizations and individuals. So without further ado, I want to present to you the first part. It's a full circle with what was just presented. So because I wanted to present to you in a different format, now I have to speak to it. So we're going to start with a breathing technique. And what we want to achieve is clarity, focus, and understanding your inner space. And breathing technique is called pranayama in yoga, and it's been around for thousands of years. My practice is understanding things from the scientific way and also the mind and body practice. So neuroscience, neuroplasticity, and the body and mind are informing every step of how I design these workshops or invitations for you to explore. So there are only two known ways of gaining conscious control over the involuntary nervous system. And what I'm reading for you today comes from The Science of Breath, which is a book written by Rudolph Valentine and Alan Himes, two doctors, and Swami Rama. And what I'm reading is about pranayama and the nervous system. So one is by systematically practicing breathing exercises and preparing oneself for understanding the various vehicles and channels of prana. And the other one is gaining control over the automatic nervous system through willpower. The more the mind is dissipated, the more the will is scattered. When the mind is made one-pointed, the willpower is strengthened. And with the help of the willpower, the autonomic nervous system functions the way we want it to. So let's start with Nadi Sodhana, which is the first pranayama technique I'm going to teach you. Maybe you have experienced that before. And for that, you can look away from the screen or whatever feels comfortable for you. I want you to start tapping into your inner being. You can close your eyes if that's available for you. I want you to sit comfortably wherever you are, even on the floor if you want to. And if you have closed your eyes, start relaxing your shoulders down. Make sure you have the head, the neck, the trunk aligned. And you're lifting through the crown of your head. Now, place your hand in a horizontal way underneath your nostrils. And then start just noticing the breath and the air coming through your nostrils. Some people will have both nostrils open, but throughout the day, and this was fascinating when I read the book, one nostril is open, the other might be closed, and they switch around. So what we want is to regulate the breath. So we're going to take the thumb and the ring finger, and they are going to help us with this practice. The index and middle fingers can be placed in between our eyebrows. What we're going to do is to make the air flow from one nostril, starting with the left one, through the right nostril. And we're going to, with the help of our ring finger, we're going to close the left nostril when we finish inhaling. And we're going to open, so the thumb is placed on the right nostril, and you're going to open that so the air flows and comes out through the right. So let's just start. Let's place the two fingers in between our eyebrows. Softly place the thumb on the right nostril and softly place the ring finger on the left nostril. Inhale and exhale completely. Close the right nostril with your left thumb and inhale through the left. Close the left, open the right, exhale through the right. Inhale through the right. Exhale through the left. Inhale through the left. Exhale through the right. Inhale through the left. Exhale through the right. And do it one more time on your own. And then you're going to open your eyes and take 3 breaths calmly. So that's considered one round. One cycle is 3 times, starting on the left, exhaling on the right, inhaling on the right nostril, exhaling on the left, that's 1. And then you did it 3 times, which are 6 breaths. And it's customary to perform 3 rounds. So we're going to go through our next round. Again, you place your index and middle fingers in between your eyes. We're going to exhale completely. Close the right nostril and inhale through the left. Close the left, exhale through the right. Inhale through the right. Close the right, exhale through the left. Inhale through the left. Close. Open the right, exhale through the right. Inhale through the right. Close. Exhale through the left. Second cycle is complete. And you can just take 3 breaths. And this third round, you're going to do it on your own. And let me know when you finish because I'm not seeing you. Go ahead and complete the third round. When you complete the cycle, take 3 breaths. And I think everybody has finished by now. Janet, can you let me know if there are any questions?
If anyone has a question, they can unmute themselves.
Is it important to start on the left or the right?
Yes, it is important to start on the left. There are the number of nuances on Nadi Sodhana. I will send a pamphlet with Janet, but the idea is that we definitely start on the left, and there are little nuances. For example, let me see. So one of the nostrils is going to help you cool down. Sorry, I've lost that too. And definitely, yes. So let me send all the details about what you can do and when. Usually the best time to do it is before sunrise and at sundown or before bed. And it is going to help you sleep. It usually helps with sinuses. And oh, now you're all back. It's nice to see you. I hope that has answered your question, but I know you want more detail on why starting on the left.
Well, I have my hand up. This is Salome. I have done it without putting the index finger and the middle finger on the forehead. Why do you do that?
The only reason is to rest because you are using your ring finger and your thumb.
Yeah.
Close the nostrils. So you are trying to block the right nostril so air only comes in through the left. And then you block the left one to exhale through the right. And that's how it's just blocking the nostrils for flow of air. You're controlling the flow of air.
I have done it just with the index finger and the thumb before. Well, I don't know.
This is how it looks like. This is my hand.
Yeah, I have done it this way, like so. Oh, okay. I was just curious if it had anything to do with the third eye or something. Thank you.
You're welcome.
Pilar, how long do you recommend doing this breathing?
The recommendation is usually 3 rounds. So inhale, exhale, inhale, exhale. That's 1 round. So you do 3. You can start with that. The normal practice, or the practice, the most common practice, is to rest after that round, which is 6 breaths. You rest for 3 breaths that are completely normal. So very calm and normal breaths into your belly. And then you start another round. You do 3 breaths to rest. And then you start again for the same 3 rounds. So 3 cycles. Inhale. You can also do these. This is interesting. If you don't want to start right away blocking your nostrils, you can close your eyes and imagine the air flowing in through the left and out through the right, in through the right, out through the left. That is also a very calming sensation when you focus on the breath coming in and out through different nostrils.
Can you clarify when you start on the left, if you're starting by breathing out on the left or holding the left nostril closed?
Absolutely. So the start of this practice is exhaling, right? So when you're ready to block a nostril, you are going to breathe in, you breathe out, and then you block the right, and you are going to inhale through the left. Block, exhale, block, inhale, block, exhale. Of course, I'm speaking, I'm not doing it. It's just to show you how it's done. Is that helpful?
Yes, thank you.
You're welcome.
I have a question. If you've damaged, if you're an anxious person and you fight anxiety every day and you've damaged your system, is there any way to reverse that in your cardiovascular system?
So I'm not a doctor, but I can tell you that these practices I'm bringing to you today can help calming anxiety for sure. And yeah. I have a second practice, a few tools. I call them tools because I like you to have tools accessible to you throughout the day. So not everybody can go to a yoga class. Not everybody can take 1 hour off when they feel anxious. The idea of my series of inner space workshops or mini workshops is to let you know about these tools, practice them. Yeah. So when you are anxious, you have access to it. In my company, it's simple. The saying there is it's inspired in Buddhism. Mm-hmm. So to live a happy life, you need to be simple. And so being simple is very complicated. It takes practice.
And that's true.
To be simple. And so it takes practice, and this is all little practices. And of course, if you have a more time and you can go to a yoga class or you can practice more, of course, you can also have that available. And do I have time to go to the second part of the series?
Yes,
how long
you do.
Is it?
I wanted to probably.
You have at least like 7 or 8 minutes, maybe even 10.
Okay. So what I wanted to then, let me switch to a shorter and easier practice. So the one I was going to show was just a simple meditation technique, which is closing your eyes and starting just to focus on the tip of your nose and on the air flowing in and out of your nose. So I'm going to leave that as an instruction, but what we're going to do is very accessible if you are at home and you need to rest your mind and bring some calm to yourself. So right now I would like you to look around you in your home and identify one object that brings you happiness or that is associated with joy, that you put it there because there is something associated with that object at your home. And write a few notes of what that is. And what type of sensation, emotion, positive emotion this brings to you. And maybe name that emotion. Now look at one part of your body, maybe your hand. And you're going to put your hand on top of a table, some very hard surface. And when your hand is soft, breathe in. And breathe out and press. And feel all the palm of your hand. And each contact with the table, and release and breathe in again. Release, your hand is soft. And breathe out and press. And feel every part of your palm on the surface. And release. And that's it. That's just a calming practice that you have access to at any time of the day. I think I'm out of time, right?
Yes, we had a instructor who taught us tapping, and the practices that she taught us were also things that we can do at any time, anywhere, to calm ourselves down, to help with stress and not have to go or be in a class. I have done them and they are very, very useful. I'm not going to do yours too.
I think that question that Carol brought up about the reversibility of chronic stress-driven physiologic and anatomic changes is actually quite important. I think I want us to take a couple minutes. Nedda, from cardiovascular perspective, do you want to just make a comment and sort of what's your opinion? Because it's actually not an easy question to answer, I think.
Yeah, absolutely. And it's definitely a question that researchers are trying to determine right now. There isn't enough to say that, yes, it's reversible just with addressing anxiety. However, like I mentioned earlier, it's very much a multi-system process. You have to take into account whether someone who's less anxious, whether they're able to eat better, their body's under less stress, so there's less inflammation. Are they able to exercise to treat their anxiety? Are they able to take their medications, follow up? So in a short answer is most likely it is reversible, but in the same time, we don't have enough research to say, yes, just by addressing the anxiety, then we can reverse the plaque process. And that's the kind of the best answer I can give right now from what I know.
I mean, I think general principle should be, chronic stress causes a long-term shifts, not just in one organ, but in many different organs. And, they are basically those shifts are adaptation of the body to a threat, in essence. So any kind of stress, in a way, the body thinks of it as a threat. And so in order to address it, let's think about it as evolutionary. In order to address the threat, the body adapts to be able to defend the worst possible scenario from that threat. And the reverse is true. So as you allowing the body to realize that there is no actual damage that needs to, or there's no, the risk is not necessarily high, you're kind of teaching that resiliency component, that the reverse happens just the same. But, you know, it's absolutely correct that I think sort of how much should you practice to reverse some of these changes? I mean, we don't have the quantitative way of defining this, but I always give people an analogy of a bank account. Like, think of it this way: you only have an X amount. Let's say you only have $5 a day to deposit. You just can't do more. And so that's the criticality of doing a daily routine, because you can't put a ton in one setting, so you have to continuously do it. And even the retreats, which we talked a little bit about when we were covering altered traits, which was a long time ago. Maybe I'll come back to that. So there's the idea that when you're in a very concentrated practice for a long period of time, like a retreat setting of the weekend, let's say, your chances of changing, causing positive change is a little higher, not a little, but significantly higher. But that's not necessarily practical for all of us in our day-to-day life, right? So the real kind of gold, I think, is in putting a commitment to doing something on a regular basis. Now, it doesn't have to be a long time. I mean, it doesn't have to be hours. But you know, some commitment of some. And what's interesting is that the idea has always been there's this magical number of 30 minutes a day. I don't know why, but it seems to be true with everything, with exercise too. You know, but if you think about this, it probably not even have to be that long. I mean, more powerful. This alternate muscle training, by the way, is extremely old and very profound, and probably in every original culture, definitely in yogic culture and Sufism and Vedanta. They're all, you know, they may be slightly different, but they all exist. And so some of this core old time practices are actually quite profound at their capacity to implement shifts in a short period of time, even though, yes, we don't have a specific medical research to support it. But anyway, I just thought it was a great question. Thank you, Kara.
Thank you.
Donna, thanks for bringing up 4-7-8 breath or 3-6, or sort of the alternating with the exhale longer than inhale. It's also a great practice. Well, I'll enjoy if we don't have to talk about COVID today. I think it's perfectly fine. I think it's the first Friday when we said nothing about COVID. Maybe that's a good sign that things are on the mend. Well, thank you, Nedda. Thank you, Pilar. I hope we'll see you guys again. Short time. I don't think we have, Dr. Frame, I don't think we have any new updates, right?
Correct. No new updates from last week.
So we'll see you guys all next week. Enjoy.
Great
weekend.
hour.
Bye. Thank you for having me.